Well, joining us now is our medical reporter, Lori Johnson. Lori, talk about this convalescent plasma. What is it and how does it work?
Well, Pat, it's a wonderful gift from God. What happens is when a virus infects our body, our immune system naturally produces these antibodies. And we've talked about these antibodies before. These are the little soldiers that battle off the virus. And so people with healthy immune systems who have already recovered from COVID-19 still have these wonderful antibodies in their blood, and they're being asked to donate that blood. So please go to coronavirus.gov or the Red Cross and see how you can donate a unit of blood, because that blood is full of those wonderful antibodies and can be transfused into people who are very, very sick with COVID-19, and those antibodies can help them. And you wonder, why do they not have their own antibodies? Because we know people with weakened immune systems don't produce enough of those antibodies. And so then the monoclonal antibodies are exactly like the antibodies that we see in our blood, except they're synthetic. They're made in a laboratory, so we don't need to rely on survivors to give their own blood. These monoclonal antibodies are being tested right now and could be available as early as next month. So that could sort of bridge the gap between now and when a vaccine is available.
Well, I understand there was a very successful nursing home study of one of these drugs. Could you tell us about that?
Right. So Eli Lilly is one of the companies that's manufacturing these monoclonal antibodies. And in the earlier trials, they worked very well. And so now 2,400 people who live and work in nursing homes in the United States are going to be trying these monoclonal antibodies. So when a nursing home has one COVID-19 case, then they notify Eli Lilly and they send out this RV and start giving people in the nursing home these injections, these infusions of the monoclonal antibodies. And these people will be studied to see how they do. Half of them will get it and the other half won't. The other half will get a placebo, and then they're going to compare the results. So that's going on right now, and the results should be available very soon. There are other trials going on. It looks like these monoclonal antibodies in earlier studies show that it's very protective for people who don't even have the virus, and then also is very curative for people who do have the virus. They're testing it among very sick people in the hospital and other people who don't have it at all, but who are at very high risk of getting it.
Lori, what about people going to school? The president said something about little children had some kind of immunity, but there are a number of cases of coronavirus affecting little kids these days. So what about people going back to school?
Well, Pat, you and I know, being in the public eye, speaking extemporaneously all the time, sometimes we say things we really don't mean. I mean, just last week I said on this program, convalescent plaza, when I meant plasma. And I think that's what happened with Donald Trump when he said that children are immune. Obviously, that's not true. We know that children get the virus. Being immune means you don't get that. What I believe he meant, and what his campaign clarified later, is that children are not susceptible. And what he really meant to say was children don't have those bad complications and deaths. That's very rare. It hardly ever happens at all. And so that's really what he meant. Anthony Fauci earlier this week, testifying before a congressional committee, said that no, of course, children are not immune. We know that we get it, but they don't have those serious complications, and certainly not the deaths that we see in older people. And Dr. Fauci said, yes, schools should reopen safely, and because the effects of kids not being in school are extremely detrimental on so many different fronts.
Lori, thank you so much. We always appreciate your insights.
My pleasure. Thanks.